You may remember a time in your life when you had a headache, or sprained something playing sports, or if you're female, experienced some menstrual cramps. In these situations, you might have reached into your medicine cabinet and pulled out a trusty bottle of painkillers. Over-the-counter pain medications are a quick, convenient, and inexpensive solution to a variety of these problems. These are drugs that can be easily obtained off the shelf of a pharmacy or even some convenience stores without a prescription. These drugs include Tylenol, which is the brand name of Acetaminophen, also known as paracetamol, Advil or Motrin, which are the brand names of Ibuprofen, Aleve, the brand name of naproxen, or Aspirin, the brand name of Acetylsalicylic acid. So with such a wide range of choices, how do we know which painkiller to choose? Well, to start with, Advil, Aleve, and Aspirin all belong to the same class of medications called NSAIDs, or non-steroidal anti-inflammatory drugs. NSAIDs act as both painkillers and anti-inflammatory medications. In contrast, Tylenol only has analgesic or painkilling effects, without any anti-inflammatory benefit. So Tylenol is not going to reduce any swelling or redness if you sprain your ankle or pull your back. Therefore, the NSAIDs may be more preferred agents in mild to moderate pain, while Tylenol is used for more minor pain. Okay, so now how do we choose between the NSAIDs, Advil, Aleve, and Aspirin? Well, at equipotent doses, the efficacy of NSAIDs are actually very similar. So really, no one medication is more effective at pain relief than the other. But there is individual variation in patients' responses to these medications. In other words, different people respond differently to certain NSAIDs. For example, you might experience significant pain relief from Advil, but absolutely no pain relief from Aleve. In contrast, your friend might have the complete opposite experience. It's estimated that the average person who is starting on an NSAID has a 60% chance of the medication working for them. This leaves the other 40% of people without any pain relief from that particular NSAID. Unfortunately, there is no method for predicting which drug will be effective for you. Thus, trial and error is your best bet. So if you take an Advil and it doesn't seem to be helping you, it might be worth trying a different NSAID. So what about the side effects of these drugs? GI side effects, such as heartburn and stomach upset, are common with NSAIDs, which is why it is recommended to take them with food. With aspirin, you can try using the enteric-coated formulation to avoid this. Stomach ulcers and stomach and intestinal bleeding is also a risk with NSAIDs. If you have a history of stomach ulcers or GI bleed, you want to avoid taking these medications. If taken at high doses for long periods of time, NSAIDs can also increase your risk of heart attack, strokes, and kidney injury. So if you're going to be taking painkillers chronically, avoid taking NSAIDs if you have a history of cardiovascular disease or kidney disease. Aspirin is an exception to this, as it is used at low doses to actually prevent heart attacks and strokes. Alternatively, Tylenol is generally considered a safer medication. The main side effect we are concerned with is liver toxicity, which occurs with high doses and with chronic use. However, this can be avoided by not exceeding the maximum daily dose of 4 grams per day.